morning, everyone. Today is Thursday, March 23rd, and thank you so much for joining into our weekly PPACA, ACA, soon-to-be AHCA webinars. Believe it or not, today is the 7th anniversary of the signing of the Patient Protection and Affordable Care Act that has now become known as Obamacare. A long time, it seems, for this much to go on. So, you know, I thought it was important to bring everybody up to date, but not to forget that it was 7 years ago that this was signed, this monstrosity was signed into law. And if you note the little picture down here at the bottom of the screen, that was that historic day that the law was signed. And so much time has passed that this young man is now a 17-year-old transgender teen. So a lot of time has passed and a lot of changes are taking place. So, you know, if you're new to this format, we do encourage you to ask questions and, you know, visit every week to learn about these changes, and everything is changing very rapidly, especially today. And you can ask questions in one of two ways. You can either type your questions into the question box and I'll answer it at the end of the webinar, or you can raise your hand and I'll unmute you and you can ask it live. And of course, all of your questions help all of us. You know, we're all going to sink or swim together with any changes that take place, just as we, you know, sink or swim together with the Affordable Care Act. So again, we can all learn from each other, and I hope that you get a lot out of these webinars. And again, I encourage you to ask your questions. So let's jump right into it. This new section, the new administration, we're going to talk about the American Health Care Act. It is set to go to the House for a vote tonight with the manager's amendments that just came out. These are Paul Ryan's manager's amendments. Some of the amendments, or this manager's amendments, includes sunset tax increases 1 year earlier. Instead of the taxes for the Medicare tax, the 3.8 Medicare tax, the high medical bills tax, medicine cabinet tax, limitations on HSAs, FSAs, device taxes, a series of tax hikes on various health industries, all of those. The amendment, instead of having those sunset in 18, the manager's amendment will have them sunset this year. They're going to allow states, as we have talked before about getting block grants. That's the manager's amendment. The American Health Care Act was a per enrollee payment to the states for Medicaid recipients. So the states are going to be able to get block grants if they choose. If states, number 4, if states haven't already expanded Medicaid under the Affordable Care Act, they're not going to be able to do that. I'll back up to number 3. States can add work requirements to Medicaid. So again, that's part of the manager's amendments. They're talking about no rollover of tax credits into HSAs, as this would allow for taxpayer money to pay for abortions. If you recall, they're talking about some tax credits being put into health savings accounts in the Medicaid system and all systems, and they don't want that to happen because taxpayer dollars could be used to pay for abortions. There was $85 billion added to allow those 50 to 64 to deduct more health care expenses from their income taxes. The report says Senate will change this into a higher tax credit for this group versus a tax write-off. Again, that's yet to be determined. There is in the manager's amendments for New York alone to change county Medicaid cost model to a state Medicaid cost model. Evidently, New York has a county-by-county Medicaid budget or Medicaid system, so that's going to move to a state model. The amendment also calls for the Affordable Care Act plans to be retained for up to 2 years. Number 9 is the big question. This is what the Freedom Caucus that is overseen by Mark Meadows, really Rand Paul is a big part of that. what they want to see to get their caucus to vote to move this bill forward today is that they wanted to add the elimination of the essential health benefits into this manager's amendment. And, you know, it seems like, I guess, a simple sort of change, but of course the Democrats are saying, well, they can't do this because people are going to have bare bones coverage. But it seems to be more of the fact that if they add the essential health benefits, that it may not be a reconciliation bill, which is, you know, purely budgetary as opposed to loading it up. They're afraid that if they load the essential health benefits into the manager's amendment, that when it gets to the Senate, that they would reject it because the elimination of essential health benefits may not be viewed as a budgetary reconciliation. So they were supposed to meet at 9 a.m. today, the Republicans again, and to, you know, further discuss all of the potential changes to get the yes votes, quite frankly. And that meeting for 9 a.m. today was postponed. I don't know if it's postponed indefinitely or just postponed because they worked late into the night. As far as I know, and from right before I went opened this up, there was, you know, no postponement of the actual vote, which is again supposed to take place tonight. So we'll see what happens. I'll keep you up to date as much as I possibly can, but this is what I know at this point. April 27th, I mentioned this last week, Starmark, which is a company that offers national coverage. It is a level-funded program. They have a new program rolling out for 5/1 effective dates, and I'm holding a webinar from 2 to 3 on April 27th. This product, I think, is really going to be interesting as there's no network associated with it. They're calling it reference-based product, or reference-based payments, because they're going to go off a certain percentage of like Medicare payments. So no network. It's going to give the folks that are insured the ability to use like a healthcare blue book and really negotiate some pricing with the providers that they choose, because, you know, it's no network affiliation. So of course providers don't have to worry about the repricing, you know, billing higher so that they can get the repricing of, you know, what is affordable for them to keep their doors open. But, you know, again, I think it's an interesting concept. 0 to 13% below the current rate. So again, for the right group, it is something that you may want to look at. And I just think the concept with no network, giving the consumers the ability to better negotiate, and no balance billing for the consumers is definitely worth looking into. So if you're available April 27th, when the invitation goes out, go ahead and sign up. If you're not available, go ahead and sign up anyway, because just as you get a recording from these weekly webinars, you would get a recording from this webinar as well if you're not able to attend. Pennsylvania Association of Health Underwriters. There is a day on the Hill, which, you know, again, I spoke about last week, where we as citizen lobbyists go to our state capitol in groups and meet with the legislators about what we want to see specific to health insurance. So I think it's timely. Again, April 25th, it's an all-day event. I will provide the information and the registration when it becomes available. They are having a prep meeting and a rally with CE credits on the 24th. And that's from 3 to 6. It's going to be at a hotel downtown where they have blocked off some rooms. So if you're interested in attending that, again, that would be within the invitation and registration. So again, as soon as I get that, I'll get it out to you. But if you're interested, just save the date at this point. Healthcare.gov notices to dually eligible Medicaid and CHIP. So let me find my things here, my notes. There they are. My apologies. So the the periodic data matching through the CHIP program and Medicaid program is going to look at folks that are eligible for Medicaid or CHIP that are currently on the marketplace receiving either cost share reductions and or tax subsidies, advanced premium tax credits. They're going to be writing out to these dually eligibles and letting them know that they are either eligible for Medicaid and or CHIP and that they're not eligible for the cost share reductions or the tax credits, and they are going to stop those tax credits and cost share reductions immediately. So if your clients receive these letters, please make sure that they follow the instructions, because one, they're not going to get tax credits and they can stay in a very high-priced plan on the marketplace, or they can do what's available to them and go into the Medicaid and or CHIP system. So if you get a call from your clients on the individual side, please just have them follow those instructions so that they don't jeopardize their coverage. Short-term coverage, I'll mention this again, we still don't have any word from National General on any site change for the 4-1 change that's taking place with short-term, but it is very popular. And if you do currently have someone that is outside open enrollment without a qualifying event, I encourage you to reach out to Judy Reed. She is the guru of short-term medical, and she can send you some links and product information so that you can sell the plans and receive compensation. Imagine that. And just as a note, I did include the Obamacare Replacement Act section, Obamacare Replacement, the Freedom Caucus's bill. So that's there for your reference. And that brings us up to the end of the agenda, and we'll open it up for now, or for questions now. Just a reminder, next Thursday, March 30th, we will have our next PPACA, ACA, or AHCA webinar. We'll have to figure out what we need to call it now. But again, hopefully you'll join in then. So let's get some questions here. And Dave says, why can't they simply eliminate the Senate rule that's tying their hands on the reconciliation bill? Dave, there's some, and I'm certainly not a legal mind, and I don't ever want to be, but there was some, in the news this morning, there was some discussion that the Senate could view this, even if Paul Ryan says that he doesn't view this addition of the essential health benefits as anything other than budgetary. But the fact is the Senate could look at it differently, and if it's pulled or denied, then they lose that chance, their one chance, they say, the short-term chance of the reconciliation. So I'm not sure why they can't. I think it's just a posturing sort of move. And Tim asks where the manager's amendment originated from, and that was from the speaker. That was Paul Ryan's amendment. Sunset tax increase. Can you explain that again? Yes, I can. There are current taxes within the law that the American Health Care Act said that it would eliminate or sunset as of 2018. The manager's amendment simply just moves that up to 2017. And it says nearly all Obamacare taxes repealed. The bill repeals all Obamacare taxes. The biggest ones are the 3.8% point for Medicare payroll tax brackets, the 3.8% surtax on savers, the high medical bills, and the medicine cabinet tax. I don't know what they are. A flurry of tax increases on the health savings account and flexible spending account. Remember, you can only, there was a limit on how much you could put into the flexible spending account, and of course, anything in an FSA is really tax deferred or outside your payroll taxes. That's all the information I have, Tim, but I will try to get you some other information. Mike says, the client that I work with is an ACA insured and moving out of the area. What are the cancellation dates? First of the next month and timing to apply for new ACA coverage. Do we need prior coverage proof to apply? Okay, let's take that one by one. The market, if they're on the marketplace, they depend, since they're all going to cancel, they can cancel anytime after the 15th. So they can call the marketplace and cancel. And for proof to apply elsewhere, they would just need proof of the move, maybe a utility bill, etc. But their moving in and of itself would give them that qualifying event. So I would encourage them to utilize the marketplace, and they can certainly help them out. Nate says, is there anything in this bill about elimination of the individual mandatory tax penalty? And yes, that's in the American Health Care Act, Nate. So that's in the original, not the amendment, the manager's amendment. So that's really it, guys. That brings us up to the last of the questions. You know, things are changing rapidly. I've said that for many, many months now, and we're going to try to keep up with it. In fact, we will keep up with it and let you know everything that's going on as soon as we hear anything. Again, I encourage you to get involved. You know, now's the time to really get involved at the state level. If you have specific goals and thoughts on Medicaid, you know, that might be something that you take up at the state level, since we could essentially be getting block grants, and how we want to make those changes to the Medicaid system. So again, stay involved, stay engaged, lots of changes, and I promise you that I will bring you the information that I have to the best of my ability each week. So again, I thank you all for joining in, and wish you a great balance of the week and a wonderful weekend. Thanks again. Bye-bye.